Mental health is everywhere right now. It's in the news, it's in leadership meetings, it's in the workplace initiatives and public conversations. It's definitely kind of a buzzword, I think. And I love that because it's progress. And even with all of that attention, there's still a gap. So when we talk about mental health, what it really comes down to is actually having the conversation, to have this real conversation to ask, how are you doing? But really, how are you really doing? Or to even be real with ourselves and admit, I'm struggling right now. I'm having a hard time. I'm overwhelmed. I'm stressed and I don't know what to do. And we hesitate and we keep it in, or maybe we're worried about saying the wrong thing at the wrong time, or am I overstepping? Maybe if I'm noticing somebody else is going through something, do I ask? Do I not ask? We worry about not knowing what to do next. And so instead, our natural response so many times is to ultimately avoid the conversation, or we try to keep it surface level, or we move too quickly into problem solving. And I really just want us to slow down, be curious with ourselves, be curious with others, and really focus in on connecting and understanding and trying to move this conversation through a little bit more carefully. And so the purpose of this series is to really close that gap and not turn everybody into a clinician. We don't have to be each other's therapists all the time. We don't even have to diagnose. That's not what it's about, not labeling. Really about making everyday conversations about mental health to feel normal. Hello, I'm Michelle Niehues, licensed clinical marriage and family therapist, and I am so excited to kick off this series on mental health. So what do we mean when we say mental health, right? Let's just give this some definition. Mental health really isn't a diagnosis. It isn't a crisis. It isn't reserved for therapy offices or emergency situations or going to the doctor. It's really a part of everyday life. It's a spectrum of looking at, am I thriving? Am I doing really, really well? My mental health feels on point. How am I thinking? How do I feel? How am I interpreting hard things that are going on? Or maybe it's something stressful is going on or really traumatic. And how am I responding to stress? And how am I managing disappointment? And so it's this whole spectrum that we're looking at. And so for one person, it might show up after something really traumatic or really difficult, like navigating grief after losing someone. For another, it might be anxiety about finances or work. For someone else, it might be a simple and as real as feeling overwhelmed about what am I going to wear to this event that's happening and it's really important. And how am I going to make a good first impression? And that may sound so small to some people, but what feels minor to one person can feel significant to another. So that's why the real mental health conversation isn't always clinical. It's cultural. It's about awareness, being curious with yourself. It's about bridging the space between what we feel internally and what we're willing to express externally. You might be familiar with the cognitive behavioral principles where our thoughts influence our behaviors and our behaviors influence our actions. So if we never speak about what we're thinking, and if we suppress our emotions or pretend like everything's fine, those thoughts don't disappear, believe it or not, as much as we wish they would. Instead, they actually end up shaping how we show up. They affect how we lead. They affect how we relate to others. So suppression does not create resilience. Expression does. Now, expression doesn't mean oversharing or turning every workplace conversation into a therapy session. Okay, we don't have to go there. However, it does mean that we can simply acknowledge that we're humans first, employees second, and patients never. So we can just show up as a human to say, I see you, I hear you, wow. And so it means being willing to say, gosh, I'm having a tough day. Or being willing to ask, how are you really doing? And it means being willing to sit with that answer too. And we have so many internal thoughts that are barriers to this. What will they think about me, right? Will it impact our relationship? Will they lose trust in me? Or maybe we're on the flip side trying to respond to them. And then one of the biggest barriers to these conversations is perfectionism. We think we need the perfect words, the perfect response, the perfect follow-up. But in reality, what matters most is presence. Even if you say something imperfectly, You can always self-correct, and you can say, oof, that didn't come out quite right. What I meant to say was, I care about you. Humility builds trust. And honestly, just saying, I hear you, you're not alone, or this is really important and I see that, is some of the most powerful words we can use during a hard time. And just pausing on that before moving into fix-it conversations can be so helpful. And honestly, some things we just can't fix as much as I wish we could. We can't. And so by just saying, I see you, I hear you, I know this is hard, is so meaningful in those conversations and is a way of just saying, hey, let's connect. They don't have to be these big dramatic conversations either. They don't have to revolve around crisis. Often these are really just small everyday conversations, everyday stressors that accumulate over time. And if we create space for those small conversations, we reduce the likelihood that silence turns into isolation. And sometimes simply just having that conversation is what empowers someone to reach out for additional support, whether that's talking to a friend, seeking counseling, or maybe using the employee assistance program, not because they're broken, not because they're patients, but because they're human, right? And we need that. We just need a place to talk and think through and figure things out. I actually often compare this to like if something's broken on our car. And at first we're like, oh, it's fine. I can drive. I'll get by without it. And we kind of go until maybe it starts giving us fits or it's not working right. And then maybe it's, oh, I actually need to try to figure this out. And at first we're maybe going to try to figure it out on our own. And if we get it figured out on our own, great, wonderful. Then sometimes like, ooh, I need to talk to my friend and ask their opinion on this. Or then maybe I get to that next point where I need to seek out some education or some understanding on it. And then sometimes it's still beyond us, which is okay. And then it might be, okay, I'm going to go to the mechanic. I'm going to go to the next resource I need. And I think the same thing is important that we do with our own mental health in that. Let me try to figure it out on my own. Let me talk to a friend. If it's beyond what I'm, can understand, or I want a little bit more in that, then maybe I seek counseling. Or I use the resources like our employee assistance program to get that extra help or assistance, right? We're not broken. We're just human. We're all in this world trying to figure it out. And that's okay. I think we can be real about that for a moment. So the real mental health conversation is not about labeling, not about diagnosing. It's just showing up and listening. It's about destigmatizing. It's about creating cultures where people feel safe saying something feels off without fearing judgment, where I'm going to get criticized or seen differently. That I can just say today's an off day and that be okay. And I'm not going to be viewed any differently because of that. Mental health is not a perfect script. It's an imperfect conversation. And when we're willing to have that conversation, even awkwardly, even imperfectly, we begin to close the gap between awareness and action. And that's where the real change begins.